Hi everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today we're going to review who requires a CLIA certification. This will be a part 1 video. The next video that will come out in sequence will be reviewing how to complete a CLIA application and how to submit. So let's just jump in and start with all of the requirements for a CLIA certificate and the resources available to you. Here we are at the cms.gov website, and you will see that they have a whole section on CLIA. That is because the CLIA guidelines are run and established by the government. All of these different bookmarks on the left-hand side are different links that will take you to different requirements. I have already shown you the demographics and lookup registry in a previous video, how you can find the information if you have an existing CLIA or you're looking for a practice's existing CLIA to make sure it's still active, to double check that the servicing location address is correct, etc. So today we're actually going to go through the requirements of who needs a CLIA certificate, what that means for you, and then all of the other resources available to you to be able to find out exactly what you need. This link for this page will be in the video's description. So let's go ahead and start. What form do I use to apply? I am going to do a follow-up part 2 video to this video, and we're actually going to go through the application and how to complete it and how to submit it. However, if you're looking for the link, it's on this page. If you run an office, if CLIA is something that you are responsible for, I would recommend bookmarking this page on your browser because it is something you will be accessing quite often. Please note that every location that you have as a practice that handles bodily fluids and collects for any kind of testing purposes does require its own individual certificate. Even if it's a certificate of waiver, every location requires their own. You can't just have one for the practice that covers all locations, okay? So that's just something to keep in mind. Also, there are some states that have specific requirements for CLIA. You do need to look up your individual state's Department of Health regarding CLIA to see if you have any special requirements regarding this. I am going to do an overall video just about the majority of people and who need to follow these guidelines. If you're applying from outside the United States and our territories, like an international laboratory, then you would need to follow some international guidelines. We're not going to go through those either, but there are resources and links here for you to access. Okay, so here is the application. Again, we'll go through that in the next video. Here it says, where do I send my completed CLIA form? We will also go through that in the next video. And what credentials do I need to apply? So this is specific for non-waived testing, which means it's everything but the CLIA waiver. Laboratory directors who perform non-waived tests, and we'll explain that in a second, including provider-performed microscopies or PPMs, must meet CLIA education, training, and experience requirements. That means if you're applying for anything other than a CLIA waiver, then your lab director needs to click this. We're not going to review it today to make sure that you're fulfilling all of their requirements to qualify as a lab director under CLIA guidelines. You'll also see that you need proof that the laboratory director has met the requirements, and you have to submit those as well, and there's instructions. All of these hyperlinks are super helpful. Again, we're not going through those today because we're doing a high level. However, this is to point you in the right direction. What credentials are needed to be a laboratory director for a CLIA certificate of waiver? Like point of care testing, again, we'll go through that in just a second. And a laboratory with a CLIA certificate of waiver, or COW, must have a laboratory director, but there are no federal CLIA educational nor experiential qualifications. Therefore, mostly it's going to be your head physician. If you're a practice where nurse practitioners can independently practice, they can be the lab director. As it's stated here, there are no educational or experience qualifications. Here is an example or explanation, I should say, of which facilities actually need to apply for a CLIA certificate. So under CLIA, a facility is a laboratory if it performs even one test. Okay, so even if your practice only performs one test that we're going to talk about in this description, you would need the appropriate CLIA certification because it would be considered a laboratory. And the tests have to be materials derived from the human body for the purpose of providing information for the diagnosis, prevention, or treatment of any disease or impairment of, or the assessment of the health of human beings. This includes tests categorized as waived complexity tests. Facilities only collecting or preparing specimens, or both, or only serving as a mailing service aren't considered laboratories, okay? Again, a CLIA certificate is not required for forensic testing. If you're just drawing blood and sending it out to a lab for it to be processed, you're not getting any results from it. Specimen collections such as urine or stool or sputum or something like that, that you're not getting any results in-house, you're sending it to a lab for that. And drug testing for purposes of employment, unless employment drug testing is done and individual treatment is offered or made available, then a CLIA certificate is required. So if you're just testing for drugs and providing that report to the employer, you do not need a CLIA certificate. If you are doing the test, getting the results, and then offering treatment to the patient based off those results, even though it's an employer drug test, then you would need a CLIA certificate. They make it very clear here. And are there additional state requirements? As I stated, some states also have laboratory licensing laws separate from the CLIA regulations, but laboratories in these states must meet both the CLIA and state requirements, and you want to contact your state agency to find out if you need to submit additional forms or documentation. Very good information, great links, very clear in my opinion. Below, you will see these are all resources that you can look at. Here is the CLIA certificate fee schedule. It was published in June of 2024. So you'd be able to see if it's a waived test, how much it is, if you need to have a replacement certificate issued because you already have it but you lost it. It gives all of the breakdown here, okay? So this is a link that you can use. Okay, so now I want to talk about the different CLIA tests and what is required, because I think that's where people get the most confused and how to decide what they need to apply for. So here is the CLIA accreditation and testing, and there is some items down below to download for a list of approved accredited organizations. For CLIA, you have a categorization of tests by the FDA. So they have all of the classifications, and you have all the boards that are involved and things like that. Let's take a look at the categorization of tests, okay? So the Food and Drug Administration has had the authority to implement the CLIA, which stands for Clinical Laboratory Improvement Amendments, Test Complexity Categorization Provisions, and it's based off of all of these things, okay? So let's go ahead. You can go to this website, and I will put the link to this in the video description as well, to look up different tests based off manufacturer, or if you have the information, to see how it is classified, okay? To see and determine which CLIA certificate you are going to need. You do want to base your certificate on the highest complexity of tests that you run. So if you do some point of care testing, but then you do some other microscopies, then you would need the PPM. If you are doing PPM and point of care, but you also do some higher complexity, then you would need to apply for that CLIA certificate. You want to apply for the certificate that is going to cover the most amount and most complex tests that you run, because it's going to also include all of the lesser ones below it, if that makes sense. This is a resource that you can find on the CMS page. However, I just went to Google and I typed in types of CLIA certificates, and it gives you this link as the first pop-up. You can see it's from 2005. However, it's all going to be the same right now, okay? So you can see that there's 5 different basically types of CLIA certificates. There's a certificate of waiver, which is like the most basic certification that you can have, and it's issued to laboratories to perform only waived tests. So a certificate of waiver is usually what primary cares would have, urgent cares, behavioral health, things like that. And it's to be able to do point of care testing like urine dips, rapid streps, rapid flus, even some of the analyzer machines that you purchase. And again, I would check with the manufacturers before you purchase them, because they will be able to tell you which level of CLIA certification you would need. Also will fall under the CLIA certificate of waiver. Okay, so that's the one I'm most familiar with. I'm also very familiar with the certificate for provider performed microscopy procedures. So getting a CLIA of waiver with a PPMP, because I do have practices that prefer to look under the microscope when they do a urine to see what they can find and things like that. So the PPMP is the certificate that they issue where a physician or a mid-level practitioner or even a dentist performs no other tests other than the microscopy procedures. And that means that it allows them to also perform the waived tests on top of it. So basically, there's no additional complexity of processing the specimens other than the point of care and then looking under the microscope at the specimens. Okay, so these are the 2 I'm most familiar with personally at obtaining for the practices I have worked for. But then you have a few other ones. So you have the certificate of registration, and that is issued to a laboratory that enables the entity to conduct moderate or high complexity laboratory testing, or both, until the entity is determined by survey to be in compliance with the CLIA regulations. Okay. So it is allowing for the complexity moderate to difficult of like CBCs, electrolytes, hemoglobin A1C analyzers, things like that. So some of the machines that you can get that would require the certificate of registration would bridge you until you can finalize and get that certificate of compliance. So this certificate is issued to a lab after an inspection finds the laboratory to be in compliance with all applicable CLIA requirements to be looked at like a lab. So this is kind of the bridge. The registration is the bridge between the certificate of waiver, PPMP, to the certificate of compliance, if you will. Okay. And then the certificate of accreditation is issued to a lab on the basis of the lab's accreditation by an accreditation organization approved by CMS. So this one is compliance with CLIA requirements. This is accreditation by CMS. So it's a little bit more hoops to jump through, and usually it's going to involve really high complexity testing like molecular testing, certain microbiology, genetic testing, and those kinds of things that are going to be a little bit more, I don't want to say high risk, but more detailed, and more information is provided. It's a little bit more sensitive information. Okay, so most of you watching most likely are going to be certificate of waiver and PPMP. Some of you might want to get the certificate of compliance because you're going to have some analyzers that you're going to want to run, some other tests, basic, easy stuff, moderate to, not high complexity, but moderate complexity in your office. And then if you want a full blown in-house lab, that's where you're going to be going to these other levels. Okay, so just take a look at this, use the resource links in the video description, figure out which one you're going to need to apply for, and then watch the next video I will be releasing that will actually walk you through the application and submission process. Thank you so much. If this video was helpful, please smash the thumbs up button. Subscribe to my channel if you haven't already, and share this with your colleagues whom you feel would be interested in the information. Thank you so much, and we will see you next time. Bye-bye.